Welcome to the Poor Prognosis Podcast. This is the first episode. My name is Hassan. I'm your host. And with me today is Ellen Decareau. She's had the unfortunate burden of being my mentor throughout my internship with MedVoice PR, which is headquartered in Austin. Ellen, thank you for being here. How are you doing today?
I'm doing great, and you have been a great intern. We really appreciate all the help you've provided us and our clients. So thank you very much. I'm glad to be
Of
here.
course. Thank you. So as you know, this podcast is about answering the questions on the healthcare system that many Americans, including myself, have. So this is kind of my outlet to talk with people who have worked in healthcare and have some expertise in the healthcare system. So I just wanted to ask you, what kind of experience do you have in healthcare and specifically health insurance?
Sure. Well, I have experience as a consumer. I've had health insurance ever since I graduated from college, I think it is. And so I know what it's like as a consumer. And then I know what it's like having had some, major health issues. My son had a few, and then having to navigate those systems. So understand it from those angles. And then also, I'm a chief strategist at MedVoice PR, and we are a health and medical PR company and have several clients in either touching the health insurance space, and we have one client who is in the health insurance space. And so we've had to get very knowledgeable about healthcare and all of its complexities. So.
Right. Yeah. This is a question that I was asking around when I was applying for my internships, and I don't think I've asked you yet. And that is, obviously, healthcare is a very kind of muddled and complex system. It riddled with inefficiencies, and it's not the most aesthetic kind of industry. So, what is it that drew you to working in healthcare?
That's a great question. So healthcare, it's pretty essential to our lives. We when we think about how we want to, what our future is like, it's usually determined on having good health. And having good health requires that we have good connection relationship with healthcare systems and doctors, and that we're able to pay for it. So that we can pay for it. And then what's really neat, and I like talking about too, is all the innovations have happened. There are so many diseases today that we're able to solve or treat very well that people were dying prematurely of just a couple decades ago. So how far medical innovation has come has really just been phenomenal, and I love being part of that space.
Absolutely. Yeah, I'm taking a microbiology class right now, and it's just insane when you kind of put it relatively in terms of what did we know about science. We were talking a couple lectures ago about how during the Civil War, we didn't even know that bacteria caused disease, and that wasn't even 200 years ago. So just seeing all that innovation and how many lives it's helped is amazing to see.
Simple things like washing your hands, becoming regimented is something that wasn't always known to do. And so that kind of is like a newer process to think of that. Washing your hands before a surgery or treating patients is like essential to preventing, disease spread. But then also, look, we have robots now operating on individuals to help them overcome really, important diseases. So it's been phenomenal. We've seen really how in the last 2 years, especially with the kind of the vaccine and how quickly they were able to move that forward, just in general, what medicine is able to do that they were never able to do decades ago. So it's exciting.
Right. Yeah, there's a ton of great things that have come out of healthcare innovation and just the overall system. One of the not so great things, as we all know, is health insurance, which is the topic of today's episode. So before we get into the real questions, I just kind of wanted to kind of just throw out some of the perceptions we have about health insurance. So for me, when I think of health insurance, what comes to mind is high premiums, high prices that you have to pay, and Medicare and private insurance companies and networks and all this jargon. But there's also this likelihood, a strong likelihood that even though if you're paying for all this insurance, you might not be covered for your healthcare. There's kind of a disconnect in terms of what I see publicly. So that's what I think of when I hear health insurance, and I just like to get your thoughts on some of the key concepts.
Sure. Well, I'd say being in college, you probably know way more than the typical college student. I don't even think I thought of health insurance once in college because I was very fortunate. I have always been a pretty healthy individual. And fortunately, I don't have, let's say, hereditary conditions too that I've had to worry about. And it's only, as I've gone older that I've realized how complicated, how expensive, how really confusing health insurance is. And it's mostly because I've gone to work. I've left college. I've gotten a job, and with that job, it comes with benefits. And then I have health insurance, and you sign up for it, and then over time, you use it. I would say though, when I really started understanding how confusing it was when I had my own incidents with the health insurance system. And I think that's usually what happens to most individuals. So you don't really understand it. It's this thing you need, but until that you are in a situation where you've had to use it and it doesn't really work well, that you're getting bills for things you don't really understand. You weren't really sure if something was in network or out of network, that you understand how complex, how you can understand something like the health insurance market. So in my particular case, my son had a respiratory issue when he was really young, 8 months old, and we had to take him in the middle of the night, and he wasn't breathing very well. So we went to the nearest children's hospital, and they admitted him. He was there for about 2 days. Over the course, and it was so great that I could do that. I'm so glad that we have a health insurance and we could do that. It was months later, you receive the bills and you start understanding what those costs were to me and those costs that the health insurance company was going to pay for. And we actually had 3 more incidents with my son having to go to the ER as we try to find the right medication for him. And so this became something that I had to deal with for over a year, and receiving these bills I didn't really understand, having to call health insurance companies, having to fight for coverage for certain things. And I understand kind of the depth of what patients who have either chronic issues, that means they have to go to the doctor a lot, or who have had these major medical acute issues where they've had to have an emergency and then they get these bills, they don't really understand it. So all those things made me understand it a little bit more. And then I also have a health insurance client and have been part of the healthcare space, working with hospitals and medical groups, and have understood a little more about how they're intertwined in the health insurance space. So when I think about it today, it's probably a lot different than I thought about a couple decades ago. But to me, health insurance brings to mind confusing, opaque, like we ever know how much it costs. Any of our medical issues, complex, outdated. I think some facilities are still using fax machines. It's not accessible. It's cumbersome, but it's also a necessity. Every single person should have it just in case. So Those are the words that come to mind for me.
Yeah, for sure. It's really sad. Like I hear your story, and it's sad to hear because those are real human lives and these are real things we struggle with. But the even sadder thing is that your story is not an exception. It's the norm that millions of Americans have to go through with their families. And it's just, I hate seeing that, the Americans in their most vulnerable position when they're sick and they need healing, they have to deal with this hassle and they don't understand it. So hopefully this podcast can be an outlet so that they have at least some understanding of it before these things happen. But yeah, so I wanted to just start off with, in terms of health insurance, just if you could tell us about who the main players of the game are, who are the main stakeholders who deliver health insurance and operate it, and who's paying for it. So if we could just get into that.
Yeah, knowing who the stakeholders are helps shine a light just on how complex the system really is. So, you have the health insurance company, but you also have the employer. Outside of Medicare and Medicaid, Medicare is health insurance funded by the government for persons who are 65 and older, and then Medicaid is for low income or adults who are disabled and or young children. And so outside of those two, the only way how most people get their health insurance is through their employer, or they have to purchase it on their own, which can also be quite expensive. So, but the majority of people think about it coming from their job. So then you have your employer involved, the health insurance involved, then you have doctors, and then you have the medical entity of the doctors. So what people don't even realize is that you might have a medical group. You assume that this entire medical group maybe is on your health insurance plan, but in fact, each doctor has a different relationship with the medical plan. So that in itself is confusing, that you could be, part of this medical group of primary care physicians, and it's not the same for the different primary care physicians. So there's that. And there's all the other medical entities. I mean, we're talking about labs and radiology, and then hospitals and urgent care centers. And so there's all those facilities as well. And then there's patients, there's people. And then there's involved is the medicines, pharmaceuticals, and even, medical device types of companies. So it's a lot of different stakeholders, and that's probably just hitting the obvious ones. There's also some unobvious ones to get into, but this is why it's so complex.
Right. Yeah. I think something that would be helpful for us to kind of understand how this kind of streamlines together. If we could go over an example of, let's say somebody like broke their leg and they're in the hospital. So what would happen in terms of insurance from the moment they entered the hospital until they left? Like, could you detail that process?
Sure. And I can even take a step back. So if you broke your leg, what you'd want to do is go, because you're in pain, you're hurting, you want to just go to the nearest hospital and get it fixed. But your nearest hospital might not be the one that's in network. So, and freestanding hospitals are often thought of like urgent care centers, and they might not be in network at all. So you're one important aspect, and this is why people get hit with surprise bills, is they don't even realize that the very hospital that they end up isn't one that their health insurance provides coverage for. So there's that. So let's say you go to the nearest hospital, and fortunately it is covered. You said, this is supposed to be in my network. Great, you get there. Well, what's complicated is that you're most likely to go through the emergency room, because it is an emergency. And not everyone in that emergency room is necessarily under your health insurance. So this is also where surprise billing comes in. You go to the doctor you go to the hospital that you're supposed to go to, that it says on your health insurance plan. And then you go with the nearest doctor, or the soonest is available. And then you find out later, oh, wait, this doctor isn't covered by my health insurance. So you might get a surprise bill, because that means you're now one of the doctor's emergency rooms are out of network. You didn't get to choose. Usually when you enter the emergency room, you go with the first ones who are available. So then there's that. Now, if you're admitted into the hospital and it is within your health insurance, then there's fees associated with that. So when you go and get admitted to the hospital, it's typically, I think, anywhere from $2,000 plus for each kind of admission. And that is probably the lowest level. If you require ICU care, which is the highest level of care in a hospital, you're probably going to pay a whole lot more, because that means you need a whole lot more care. You need more devices, you need more nurses, more care team. So if you're just there for admission and they're going to fix you there, then you're going to be admitted in one day, let's say, recover and go home the next day. So months later, you're going to get a bill. And the bill is usually going to say how much the insurance is willing to cover of your hospitalization or over your medical experience. You might get multiple bills. It could be that the anesthesiologist who maybe was needed could send you a separate bill than the hospital bill. So now you're receiving multiple bills and you're receiving information of variations of what they're able to cover. So now you have to look at and you're saying, okay, well, my deductible is this, and I have to pay this. And is this right? And let me call up the different medical groups and the health insurance to figure out. So it's really just from one situation, you could end up with multiple bills months later when you don't even barely remember what that experience was like. And now you're left with navigating it. And if you have a high deductible plan, you're probably paying up to what that deductible is. And high deductible plans, I think right now are considered $1,200 or higher. So you may be on the hook for at least $1,200 if you haven't hit your deductible in any other way. So it's that's an example of just a broken arm or broken leg. It gets more complicated as you need more care because you need more specialists, and then it costs a lot more. So.
Right.
Imagine, let's say, if you had a chronic condition, if you had to go to the hospital multiple times for different types of surgeries or because you were in you have heart issues or gastro issue. Imagine repeating that sort of process over and over again. And it's just tiresome for some.
Yeah. I mean, based off what you said, it sounds like where a lot of this gets sticky is when the doctors are not in your network and they're not covered by your insurance company. So do you know like why these networks even exist? Is it just contracting with private companies, private insurance companies? Like what's the origin of these networks?
Well, that's exactly right. It's a contractual relationship of reimbursement that exists between the doctor or the medical entity and then the health insurance company. So there's so many different types of health insurance companies, and so many different types of relationships of contracts. It's the very reason why now healthcare medical groups have a separate and administrative personnel who just manages sometimes those relationships, because it's complicated but really important, because that's how you get payment.
Right. And in your experience, do you know how much a bill, if you're in network, would be relative to an out of network bill? Like, is there any data on that you know of?
I don't know of any data, but I mean, it really depends on what it's for, whether it's a specialist or, let's say, a primary care, so different levels, or whether it's a hospital. But I mean, the variation is usually pretty huge if you go out of network rather than you stay in network. So the incentive is always to try to stay within the types of the doctors and medical organizations that they have contracted with.
Okay. Just from my personal reading, I've heard that insurance companies can get kind of sneaky with who they're contracting with, and a lot of it's kind of hidden under the rug. Is there any way for patients to understand like who's in their network and like which doctors are in their network before they actually go and get care, so they actually have some sort of transparency?
Well, yeah, the best thing to do is and it's a really good question, is to be knowledgeable about your health plan before you need it. So right when you sign up, or if you have options or able to choose what your health plan is, understand what doctors are in network and which hospitals are in network and which urgent care centers are in network before you actually need it, especially on the urgent care side and the hospital side. These are places that you usually visit when you feel really terrible. You're not in a position to call up your health insurance company and find out if this is in network or not in network. If you're feeling terrible from the flu and you just want to go to the nearest place, well, it would be terrible to, on top of feeling terrible, is to also get a big surprise bill. And that's because you weren't aware that that urgent care center or that hospital was not in network. So I'd say number one thing to do is to make sure you are aware of what your hospitals, urgent care centers, and your doctors and which ones are in network. Now, in a typical, if it's more typical and you're just seeking consultation on something, or you're doing a checkup, you probably will know if they're in network. And that's because when you call to make an appointment with a physician, they usually go through that process. Usually though, you don't have the time, you do not feel well enough to actually do that when you're feeling pretty terrible. So I highly recommend everyone to look at their plan.
Absolutely. Cool. Okay. That's great advice.
And I could throw one more thing in there, Hassan, and this is just so that everyone also isn't surprised when it's not just to know who's in network and not in network, but definitely know or have a better understanding about what you're going to pay. So if you go to a primary care physician, you're going to pay this. If you go to an urgent care facility, you're going to pay this, or a specialist, you're going to pay this. If you're not aware of those things, you will be surprised. And then if you're aware of those things, you might make better choices. So knowing that the urgent care center might cost this much more than, let's say, if you did after hours at your primary care clinic, well, you might choose the after hours instead of choosing the urgent care center. So it's knowing the costs and knowing what's in network you'll be a much more knowledgeable healthcare consumer.
Okay. And this data on who's in network, can that be found on hospital websites and like clinic websites, or?
Yeah, most places. Well, the first place to start is your health insurance provider, and I find if they usually have a good system for you to be able to look up which physicians are in network. But most medical groups also have it, so you can learn about all those things really even while you're researching which health plan you want. Oftentimes employers will give you choices. And if there's a doctor that you love and you don't want to see anybody else except that doctor, you're probably going to research if it's in network to which plan. So this is all information that you can do on the website of the health insurance provider.
Got it. Okay, that's great. I understand there's a lot of systemic issues that we need to fix in healthcare, but it's good to know that for patients who are educated or people who are educated, they can go out and find information and learn something about the processes, and they could save potentially thousands of dollars. That's like, thank you for saying that. I think people will appreciate that.
Well, and there's something I'll add to that. First of all, medical groups and health insurance companies, they make mistakes sometimes. And, I had a personal situation with this where I got a very big surprise bill. My son had to go to the emergency room, and there was a doctor there who was not within our in-network providers. And I fought it. I explained, I sent a letter to the health insurance company, explained the situation, and they did recognize that in this situation, they were going to cover it. So, advocate for yourself. If there is a situation where a bill seems unfair, then you need to contact your health insurance. It's work, but it might be worth it. So it's you contact your health insurance provider to get more information about why, and find out how you can appeal it. And once you say the word appeal, there is a process that every health insurance company has for you to try to get that health issue covered. So.
Right. Yeah, great. I think that's a good wrapping point. I understand we've barely begun even scratching the surface about all the different types of health insurance plans, and there's a lot of rabbit holes. So I think now would be a good time to end it. But Ellen, thank you so much for coming on to the podcast and being my inaugural guest. I really appreciate it.
Thank you. I enjoy the opportunity to try to educate some more individuals. It's a complicated situation, but really important to have health insurance. So my one leave away here is just to make sure you advocate for yourself and just be knowledgeable before you really need it.
Okay. Is there anything else that you'd like to say or plug to the millions of people that are surely watching this?
Well, I hope it gets better. The health insurance, as complicated as it is, it's really important, and it's not worth not having it because it is very expensive to have a healthcare issue and not have health insurance. Medical debt is a real issue, and a lot of people in medical debt didn't have health insurance. So just keep trying to find a situation that works for you. It is a very important thing to have. So.
Right. Well, thank you again, and thanks to everybody for listening. I really appreciate this, and I'm glad to see that I've actually started this podcast and I'm taking it somewhere with some amazing guests. So thank you everybody for watching. Take care.